Argentine hemorrhagic fever or O'Higgins disease, also known in Argentina as mal de los rastrojos, stubble disease, is a hemorrhagic fever and zoonotic infectious disease occurring in Argentina. It is caused by the Junín virus. Its vector is a species of rodent, the corn mouse. Epidemiology. The disease was first reported in the town of O'Higgins in Buenos Aires province, Argentina, in 1958, giving it one of the names by which it is known. Various theories about its nature were proposed. It was Weil's disease, leptospirosis, caused by chemical pollution. It was associated with fields containing stubble after the harvest, giving it another of its names. The endemic area of AHF covers approximately 150,000 square kilometers, comprising the provinces of Buenos Aires, Córdoba, Santa Fe and La Pampa, with an estimated risk population of 5 million. The vector, a small rodent known locally as raton mycero, suffers from chronic asymptomatic infection, and spreads the virus through its saliva and urine. Infection is produced through contact of skin and mucous membranes, or through inhalation of infected particles. It is found mostly in people who reside or work in rural areas. 80% of those infected are males between 15 and 60 years of age. Clinical aspects. AHF is a grave acute disease which may progress to recovery or death in 1 to 2 weeks. The incubation time of the disease is between 10 and 12 days, after which the first symptoms appear: fever, headaches, weakness, loss of appetite and will. These intensify less than a week later, forcing the infected to lie down, and producing stronger symptoms such as vascular, renal, hematological and neurological alterations. This stage lasts about 3 weeks. If untreated, the mortality of AHF reaches 15 to 30%. The specific treatment includes plasma of recovered patients, which, if started early, is extremely effective and reduces mortality to 1%. Ribavirin also has shown some promise in treating arenaviral diseases. The disease was first detected in the 1950s in the Junín partido in Buenos Aires, after which its agent, the Junín virus, was named upon its identification in 1958. In the early years, about 1,000 cases per year were recorded, with a high mortality rate. The initial introduction of treatment serums in the 1970s reduced this lethality. The vaccine, the Candid No. 1 vaccine for AHF, was created in 1985 by Argentine virologist Dr. Julio Barrera Oro. The vaccine was manufactured by the Salk Institute in the United States, and became available in Argentina in 1990. Candid No. 1 has been applied to adult high-risk population and is 95.5% effective. On the 29th of August 2006, the Maztegui Institute obtained certification for the production of the vaccine in Argentina. A vaccination plan is yet to be outlined, but the budget for 2007 allows for 390,000 doses at $8 each. The Institute has the capacity to manufacture in 1 year the 5 million doses required to vaccinate the entire population of the endemic area. Between 1991 and 2005, more than 240,000 people were vaccinated, achieving a great decrease in the numbers of reported cases. The Junín vaccine has also shown cross-reactivity with Macapato virus and, as such, has been considered as a potential treatment for Bolivian hemorrhagic fever. Weaponization. Argentine hemorrhagic fever was one of 3 hemorrhagic fevers and one of more than a dozen agents that the United States researched as potential biological weapons before the nation suspended its biological weapons program. The Soviet Union also conducted research and developing programs on the potential of the hemorrhagic fever as a biological weapon.